going to talk about hormones, aging, and how to move through all of that gracefully. So, where do we really start with all of this? And I love this evaluation of the metabolic cascade as to where hormones really start. Everything starts as cholesterol and then moves to pregnenolone, perhaps on to progesterone or DHEA. And then depending on what's really going on with cortisol and some of the other issues, it really depends on whether or not we're going to see a shunting down the androstenedione onto aldosterone, over to testosterone and estrogens, or if we're going to follow the corticosteroid pathway. And that plays a huge role because we all know that cortisol can also block the progesterone receptor, which can then really mess things up. And so when we're trying to sort out these hormones in this laundry list of symptoms that a woman presents with, it's important to really see where in the pathways this becomes an issue. And if you'd like a copy of this, let me know. I'm happy to send you a copy of this. So really, hormone imbalances start in the 20s, if not earlier, and certainly then progress beyond. The symptoms tend to be fairly general, and unfortunately, it just kind of accepted as part of the thing. Commonly in the allopathic world, we do see birth control pills prescribed an awful lot to help kind of curb some of those hormonal symptoms, whether they be heavy menses or menses that are very irregular. Usually birth control pills are tossed in the general direction of the woman. And that can further change everything from the gut biome to how we will see things metabolized through the liver, and even how she will then utilize her hormones down the road. So today we're dealing with a wide variety of individuals, a lot of women who are between 55 and 70, who experienced very high doses of oral contraceptives back in the 70s, 80s, and 90s. And we're seeing that these menopausal issues are a little bit more tricky to handle, mainly because of the metabolites that could possibly be hanging around. And that is very true, because the oral estrogens can forever change the gut biome, and that can definitely change how hormones are even recycled throughout the body, because we do waste our hormones through the fecal material. But if there are some interruptions with gastrointestinal issues, then we usually see even more complication with hormones. Would it be possible to get the PDF of this presentation? Okay, thanks so much, Scarlett. There we go. So as we move through, I wanted to really, again, talk a little bit about the symptoms of menopause and where they fall together, and to then also take a look at where those symptoms happen, where they come from. And truly, a lot of women feel that they are absolutely suffering, which is really unfortunate. But a lot of women who are easily in their late 50s and even through their 60s are just suffering. And there's a wide variety of allopathic offices that if you're 50, 55 or above, they are not going to prescribe you hormones anymore. In fact, they're asking women to decrease their hormone use, which is unfortunate because not everybody goes through menopause in their 40s, whether it's surgical or natural. And we have so many studies that show that if we maintain really good hormone balance, we actually see not only better cognitive abilities, but really physical abilities as well. So I really wanted to give a shout out to Dr. Pam Smith. She's one of my most favorite people on this planet, and she has some fabulous books. And the one specifically in the middle is What You Must Know About Women's Hormones, has been revised, and there's another version of that, another generation of that coming out very, very soon. And there are some other books that she has available that will be out between now and springtime. So we hope to be able to bring some of those as well. We're working really hard, by the way, to have Dr. Pam Smith come join us. And we're really, really hoping that she will be able to grace us with her presence here in the Pacific Northwest. So a few things to consider when we're looking at hormone replacement therapy is really, it's absolutely, we're trying to relieve a variety of symptoms, but we also want to look to the future. And the three things that women do not want to lose is they do not want to lose their eyesight, they do not want to lose their memory, and they do not want to lose their ability to move. So that's where we see prevention of memory loss, heart health, bone production, and growth and repair be very considerate when we're taking a look at hormone replacement. And hormones that regulate growth and repair are specifically insulin, growth hormone, testosterone, estrogens, and DHEA. But we see a wide variety, literally a laundry list of menopausal symptoms. And some of these are a little more general, and sometimes we're like, oh, really what's going on? And a lot of these are not just a lack or an imbalance of hormone, but very much the interplay of what's happening with cortisol levels as well with thyroid levels. And definitely we can see the play and the interchange with what's happening in the gut. Here's even the list continues. So we definitely want to test. We don't want to guess. And I will say in the allopathic world, we see a lot of guessing. There are sometimes when I will be talking to a provider and they'll be calling in a bioidentical compounded hormone prescription, which is fabulous, but they start at pretty moderate to escalated doses. And so when I ask, well, what is she showing on her test? Oh, well, we don't do that here. We don't test. There's no reason to test because, testing is just a very small pinpoint in time. And yes, it is a pinpoint in time, but if you test, routinely, at least once a year, not only is the practitioner then have basis to confidently understand and improve the doses that they are recommending and prescribing, but then they also can show the patient, this is how you've improved based on the prescriptions that are being dispensed. So I wanted to highlight a little bit about the difference in testing. So serum testing is really pretty much the gold standard. There's a wide variety of hormones that we can only look at in serum, which is specifically thyroid. We can catch cortisol levels in serum. We can catch hormone levels in serum as well, although it is a little bit more difficult. Blood spot testing is really a snippet in time as to what's going on in the capillary system. And when we are applying topical hormone, it is recommended to either use blood spot testing or even saliva testing because of how the hormones are then driven through the skin, through the capillary system, and then delivered to the target tissues. We don't see blood levels or serum levels changing a whole lot when we're using topical hormone. If you're using oral hormone, perhaps you can actually capture that data on a serum test. But again, you have to be very careful about the timing of that because even oral doses don't last in the body for 24 hours. We're lucky to get 8 to 12 out of that. So depending on when that serum is drawn, you may or may not see that. Urine testing is also called Dutch testing. It's a dry urine testing, and there's a wide variety of companies that provide urine testing as well. And that's a great way to look at metabolites. I personally have a really hard time dosing off of urine testing. I can dose pretty easily or recommend dosing, I guess I really should say, off of saliva testing and blood spot much easier than I can dry urine, just because there's so much more to know about how she's actually metabolizing, what's going on with her liver, truly what's going on with her gut, and even her kidneys, to then further understand how much hormone should be replaced. And I find that Dosing off of urine testing tends to be more of a dart at the dartboard application than really taking a look at saliva, whereas saliva tends to be more of a clearer look of the hormones as they passively move through the salivary glands. It's a truer representation as to what's happening in the cellular body. And that is information that's proven in science by ZRT Lab. And again, if we go through any of these citations, if there's anything that I mention, or if there are citations on the slides, please let us know if you'd like to have copies of those. We have everything to back this up. Cheek swab testing is another way to take a look at either genetics, like 3x4 genetics, or we can even look at hair loss or hair growth with that. So basically, to summarize, there's pros and cons to every different type of test, and it really depends on what exactly you're looking for. Sometimes we need to use 2 or 3 different methodologies to really get at the root issue that we're trying to evaluate, potentially prescribe or treat, and then help correct. And the reason why I say that, that quite a bit of this information really is knowledge, and knowledge is power. Most women tell me that they just want to feel normal again. And that whenever I hear that, that really, that takes me right down to the core, because what exactly is normal, and how long has she gone without that feeling? So if we don't test, we have a wide variety of risks of taking a look at hormonal changes. So this is a 20-year-old slide. And actually, I couldn't find my slide. I found my paper copies, so I had to take a picture of it on my desk to actually include it in this presentation this evening. But I love this matrix, so to speak. And it really shows if you increase stress, what happens with ovarian function, what happens with poor diet, which leads to insulin resistance, and truly what happens when we have lower progesterone, and what happens with prolactin and sex hormone binding globulin, which can then affect thyroid. And, just this cascade and this inner working of the endocrine system. It's difficult to focus on one area because it's more than just one area. We're more than just ovaries. We're more than just cortisol. And to just check LH and FSH, we could be missing a lot of the other part of the picture. But the reason why Dr. Zava put this together and really focused on breast cancer is that in 2002, which again, it was 20 years ago, he put this matrix together because he had just finished a very large study of Scandinavian women, mainly in Finland, and he was running a lab in Switzerland, and he realized that women of Finnish, Swedish, and Norwegian descent have a fairly high incidence of breast cancer. So he did a very deep dive into why that was happening. And one key component that I don't really see on this slide that he did talk about is vitamin D. And of course, being that we are in the beautiful Pacific Northwest, which is a very similar latitude to some of the Scandinavian countries, we do see a lot less vitamin D production. So we need to make sure that that's nice and high throughout the year. Symptoms can be very confusing. They can overlap, and they can be challenging to really sort out. But I do go back to a way of understanding kind of the cascade of how everything works together. And we just cannot forget what's happening with cortisol, thyroid, and even the gut biome. Because sure, we can throw estrogen, progesterone, testosterone, DHEA at her, but what exactly is she going to do with that? And is it really going to change her symptoms? And it might change her symptoms. She may feel fabulous, but then what's going to happen 4 months down the road, 5 months down the road? So we may see beautiful, wonderful changes, and she may just think that that all the providers that she is seeing are angels sent from above. And that is an absolute true statement. I'm sure that all of these providers are angels sent from above. But then if their symptoms return, they might rethink that, and we don't want to go there. So it's important to keep up with the patients and check in with them. And that's what we're here to help do as well. So for the next little bit, this will probably take about 45 minutes or so. I want to go through, and there's a lot of slides here where we're going to talk about the various individual hormones and how they work in the body and how they work together. And estrogen has over 400 functions in the body, including, it stimulates production of choline acetyltransferase. It helps prevent Alzheimer's disease. It increases metabolic rate, helps regulate body temperature, helps maintain muscle mass, and it helps improve sleep. And it really helps to improve insulin sensitivity. It reduces the risks of cataracts. And so that's very interesting because we are seeing more and more cataracts in perimenopausal women, especially if she has just general symptoms. But we see a better control of blood pressure, specifically through dilation of arteries. And it enhances magnesium uptake and utilization. And magnesium is a natural muscle relaxer. And it too has over 400 functions in the body at any given time. But the other thing is that it really helps to maintain that good amount of collagen in the skin, because none of us like to feel like we're getting older, right? Lots of wrinkles, lots of creases. We want our skin to be smooth and supple. So it can also help with cholesterol issues, as well as preventing its oxidation, so that we can get in trouble with some of the triglycerides and the very small lipoproteins. Helps with fine motor skills, and it helps with a positive effect on emotions. It increases HDL. It helps to decrease lipoprotein A, which is very important for a wide variety of inflammatory factors. It improves mood, increases concentration, helps with bone density, helps prevent glaucoma, increases sexual interest, reduces homocysteine, therefore reduces inflammation, decreases wrinkles, wide variety of other issues. But truly, when we're taking a look at what's going on in the mouth, helps to prevent tooth loss. Now, if we're dealing with estrogen excess, so what does that mean? Does that mean that she has just a ton of extra estrogen and everybody else is completely balanced? Well, no, not really. Sometimes estrogen excess can literally be an absolutely normal estrogen level. It's just perhaps she has lower progesterone levels or even higher testosterone levels. And because testosterone will elevate whenever progesterone is reduced, and we know that testosterone is further metabolized onto the estrogens. Wherever we see an estrogen receptor, we usually see a progesterone receptor very close by, if not right next door. We need those two sisters to hold hands very well so that they can work together synergistically and help each other to work very, very effectively. But when we see excess, we can see changes in cycles. We can see an increased risk of autoimmune issues, a wide variety of uterine fibroids because there's excess growth in the uterus. Estrogen's a growth hormone. We can see headaches, even those cyclical migraines, as well as changes generally in depression, anxiety, and a wide variety of other uterine and cervical changes. So yes, sometimes excess estrogen is due to taking in too much estrogen, whether that is from the environment, like xenoestrogens, perhaps fertilizers, even like receipt tape. Sometimes there's extra estrogens in that. It could be that we're just not eliminating estrogens appropriately, which means that we're recycling those and putting them back into the body. Lack of exercise, lack of movement. A very standard American diet, something that's very sad, it can definitely contribute to that. There's a lot of estrogen in the standard American diet. And if we increase 16-hydroxyestrone, we will see an elevation of excess estrogens throughout the body. I see and I hear a lot of comments. We see a lot of patients who call to ask general questions. They might even come in just to ask questions about what's going on in their body. And they're just they're tired of feeling really yucky. And they don't quite understand things, and they feel less than. They feel they don't feel sexy. They don't feel that they are a good partner or a good marriage mate. And it's interesting how they also then feel that they're not as good of a parent or even a workmate. They just, and they kind of pull back, and then they become less productive, which then is this vicious circle all the way around. So we really want to maintain not only good estrogen levels, but really good hormone balance. It's really about this beautiful cascade or symphony of how things work together. There are some fantastic studies out there how estrogen can definitely decrease Lewy body dementia and even decrease the formation of plaques associated with Alzheimer's disease. And I think that that's one thing that is a pretty scary issue, no matter how old you are, is the whole idea that we're kind of gently or carefully, slowly losing our minds and kind of easing into that. There's a lot of 50s, 60s-year-old people that are having to take care of their aging parents, and a lot of times there's a lot of memory loss, if not full-blown dementia and Alzheimer's associated with that. So it's very important to keep in mind.
Michelle,
It does turn on. I'm sorry. Yes.
sorry, we have a question in the chat.
Yes.
The question is, what is your preferred numbers for the hormone levels, aka what is excess in your opinion? Do you usually take the reference range or numbers from the lab company?
Yeah, so every lab company is going to have some different reference range, right? So I like to look at everything as kind of like a gas gauge, right? So you've got a high and you've got a low, you've got a midpoint. And if you don't know what that midpoint is, you take the low and you subtract it from the high and you divide by 2, and that's, and then you add that to the bottom, and that gets you the midpoint. So if your bottom number is 0.5 and your high number is 3, the difference between that is 2.5. So half of that is 1.25. So your midline would be 1.75. So to me, everything should be right up the middle, if not just slightly to the higher side, just barely optimal. Because that's the other thing that we have found, is that a lot of times when somebody has this laundry list of symptoms, or they've been deficient for a long time, it's kind of like they're sitting in a really deep hole, like a 4-foot deep hole. And you then get to choose how you're going to help them fill that hole in so they kind of come up to the surface. Well, that doesn't mean that they're in excess. That just means that they're baseline. And to me, baseline is right in the middle. So I try to use more of like a backhoe or a big shovel to help them fill up that 4-foot hole, because it's going to take a long time if I just use like a little garden trowel or a tablespoon. And she's going to be bored and she's going to be ticked off because it's just taking so long. Plus, she's going to be calling all the time. And that's not something that providers have time for. And quite honestly, we don't have time for 10,000 telephone calls every day either. So I do use the reference ranges based on that lab. And I try to look at everything right in the middle, if not slightly above that. So I use ZRT Labs a lot. I really have enjoyed their saliva tests. They do some dry urine tests. They do neurotransmitters. They do heavy metals. They can help map a menstrual cycle. There's infertility panels, cardiac panels, weight loss panels, let alone the integration between a wide variety of hormone, thyroid, cortisol, et cetera. And some are done in blood spot and some are done in urine. Some are done in saliva. But when you do a test and then maybe in 6 to 9, 12 months down the road, you repeat that test, they will actually give you both sets of numbers. So whatever you run before and then your current numbers. And that is a really amazing option to see those reference ranges and see how that individual is improving. Plus, their requisition that they provide, the patient has to rate their symptoms very easily, as in none, mild, moderate, severe, in a numerical format. And that is then quantified and put in the results as well. And then there's a really nice narrative. So the results come back in about 7 pages. And then you get to see what she has told the lab. And then you get to see exactly what the labs come back. So that's, and ZRT, I feel, is very price conscious. They're really good at taking a look at prices and making sure that people are not having to spend gazillions of money. I mean, a retail price for a basic hormone panel is $200, and extended with 4-point cortisol is $260. And if you added those two together plus a complete thyroid test, it's $380. I mean, I have Kaiser, and they wanted like $700-800 to run the exact same thing. No saliva, it was all serum. And I mean, heck, I'll take $380 any day. And great, it's out of pocket, but it was going to be out of pocket no matter what anyway, just because a lot of times I'm not going to meet my deductible, right? Because it's so high that it's just not there. So there's also a lot of questions that come up about how estrogen actually helps with heart issues. So are there cardiovascular benefits or not? So exactly where does all this science come from? And really, what does it actually mean? So here is the specific notation for the Women's Health Initiative, and also the ELITE trial and the menopausal hormone treatment. And what we were able to deduce is that if women are started on hormone, bioidentical hormone, within 5 years of menopause, they have a much better outcome, less further down the line issues, but we see better protection of heart issues. We see better protection of bone. We see better cognition. And so this is a really great study, and it's not that old. It's 3 years old. But also, when information was presented by a wide variety of physicians, they took a look at a wide variety of coronary scans and found that when someone was on specifically topical HRT, they had less issues of hardening of the arteries and plaque formation, less levels of coronary calcium, which then only improves survival age. Nobody wants to be thinking, oh my gosh, I'm going to die when I turn 70, right? I mean, that's so young. That is so young. But we still have to look at the science. We're scientists, and we need to take a look at really what's being said. I really wish there were a way to compile all of this information without, manually having to do it. But even when I do PubMed searches and a wide variety of other Medline searches and things like that, those searches give me listings, but I still have to go through the summaries myself, right? So again, here's a couple more citations. They're fairly new, 2016 and 2018. And when we take a look at estrogen balance, especially early on, we do see that there is a lessening of development of cardiac, I always say cardiac when I see cataracts, less development of cataracts, which is going to help improve her eyesight. So I felt that this was a very interesting journal publication. So this is from 2014, and this was a review and meta-analysis evidence that literally showed by using low dose combined estrogen therapy, there's a decreased risk of developing diabetes and better diabetic control. So that is one of the concerns, that if you give someone estrogen, are they going to have issues with cardiovascular problems, which we know that when people are diabetic, they tend to lean that way. Well, again, it has everything to do with the dose and the delivery route. A lot of the opinion that's been formed was formed on studies that were conducted back in the 70s and 80s, and that was all oral estrogen. And oral estrogen works in the body a lot differently than when we can use something sublingual or topically. Estrogen deficiency has been suggested to be the state of accelerated aging. Oh my gosh. And this isn't new. This is from 2003. But more recently, in a 2013 study, we saw that researchers were estimated that over the past decade, between 18,600 to 91,600 postmenopausal women ages 50 to 59 who had a hysterectomy, so that's a surgical imposed menopause, have died prematurely because they did not take estrogen. Now, it's interesting because several friends who had hysterectomies in their 40s, they immediately had a patch, slapped on their behind as soon as they were in surgery or just coming out of surgery. And what I find really interesting is that that's assuming that there was an estrogen deficiency to begin with, when changes in bleeding can be estrogen excess. But why is estrogen in excess? Is it because progesterone's already dropped off? So by adding estrogen to an estrogen dominant situation, have you really corrected anything? I don't know. I don't want someone to run into cardiovascular issues or even diabetes or suppression of thyroid just because nobody actually evaluated what was going on. So another study, and this is from 27 published other studies, saw a 28% reduction in mortality under the age of 60 who used hormone therapy. And those participants also noted an improved quality of life. A lot of these studies were actually conducted overseas, and that's primarily because those communities tend to be less litigious, and so they have a broader ability to conduct survey and really help women feel better. So again, more citation on when someone is low in estrogen and how we can actually improve this. The method of estrogen delivery is vital in assessing its benefits and uses. So the one thing that this study showed was that estrogen should go transdermally or transvaginally. So I want to clarify this. Estrogen transdermally means it's going to go through the skin to the serum. When I asked Dr. Smith what she really meant, and because she actually knew the individuals that conducted this test, they stated transdermal, but they really meant topical. So topical means it's going to go in through the first few layers of the skin and then be delivered by the capillary system, so that we're not trying to drive it deep in the skin. But we do see improved estrogen levels if we are using vaginal creams. We do have to be careful again of the base and what is being used. And it's not necessarily always delivered directly into the vaginal vault, but applied labially, and that also helps. And there tends to be a lower risk of DVTs. So when estrogens are given by mouth, we do see an increase in blood pressure, increase in the metabolism of estradiol to estrone, as well as elevated liver enzymes, because again, the estrogens are going through the liver. It will increase sex hormone binding globulin, which can decrease free testosterone. SHBG will preferentially bind testosterone. We do see that it will lower growth hormone, and it can, oral estrogens, because of the metabolites that are formed, can increase prothrombic effects as well as CRP, and also increases carbohydrate cravings. And it also can change the estrobolome and the biome of the gut. So, quite honestly, when we're talking about oral estrogens, in my professional opinion, I don't feel that there is any room to use conjugated equine estrogens. I just don't understand the need for using something that comes out of the back end of a horse for a human, because those estrogen components, those equine estrogens, are so potent, and our liver doesn't metabolize them very well. So you see excess effects of conjugated equine estrogens much more than you see oral estradiol. And the Women's Health Initiative was abruptly stopped after just a few years because of the use of conjugated equine estrogens along with progestins. And we did see an increase not only in DVTs, thromboembolism, but also an increase in the risk of breast cancer. So the beauty of compounded treatments is that they can be individualized. We can use a little bit of estradiol, a little bit of estriol. That is called biest. That means 2 estrogens. And it is really the only method for obtaining estriol anywhere in North America is through compounded product. There is nothing commercially available. And at this point, we do not use triest, which is a combination of estrone, which is E1, estradiol, which is E2, and estriol, which is E3. There's just much newer science that shows that the use of estrone is just not necessary, because what we really want to push is her metabolism of estradiol. We want her to sulfate it and convert it to estrone so that it will be stored as estrone. And then when it's necessary, the estrone will be enzymatically then changed back to estradiol. So let's move on to progesterone. So progesterone, again, a very important sex steroid hormone, is one of the very first hormones that drops off in perimenopausal years, and which can be as early as the 20s, but definitely into the 30s and 40s. Progesterone is primarily made in the corpus luteum upon ovulation. It can be made in the cortex of the adrenal glands as well. And it is metabolized from pregnenolone in the body, and pregnenolone has other functions as well. So progesterone, here's some wonderful functions of progesterone. It does help estrogen to balance and work more effectively. It can potentiate GABA. It can help with positive effects on sleep, especially if you're using oral progesterone. We use it for its metabolites to help induce sleep and help people to be calm. Helps maintain bladder function, helps obviously maintain a pregnancy, as in progestation. And it is an anti-inflammatory. There are some surgeons that actually will bathe surgical sites in topical progesterone. We see it will increase metabolic rate. It can increase scalp hair, and that's primarily because of how it works on the hair shaft, the hair follicle, excuse me. It will induce conversion of estrone to the inactive form of estrone sulfate. It can lower LDL. It will modulate oxytocin receptors by binding in the hypothalamus, which is going to help her feel calm and connected and happier. And it actually helps promote Th2 immunity. It protects breast health. It helps support the immune system. And it also has a role in the formation of myelin on the nerves. When we see progesterone losses, and this again can happen even in the 20s, we see an increase of anxiety, depression. And again, these are symptoms that is part of that laundry list that women usually show up with and definitely want to decrease. Now, there's certain causes of low progesterone. It can be an impaired production. For example, polycystic ovary disease can definitely impair the production of progesterone because the corpus luteum may or may not be ripe enough to produce that. Anytime we have low luteinizing hormone, because again, that's going to help select the follicles and work through that. Elevated stress, excess arginine consumption, increased sugar. So in other words, poor diet. Deficiencies in a wide variety of vitamins, and also decreased thyroid hormone. And now that isn't that somebody's taking exogenously, that means the natural production of thyroid hormone. So synthetic progesterone they're called progestins, and they do not work the same as natural progesterone in the body. And some natural progestins can actually increase inflammation in the body. And there are areas in the package inserts of the progestins that they are not to be used during pregnancy. So that is literally opposite of progesterone. So as a pharmacist, I get a little tweaked when somebody calls a progestin progesterone. They are not the same. They might sound a lot alike. They may be spelled very similarly, but they do not work the same in the body, and they are not interchangeable. So when we see a wide variety of ingestion of progestins, either through birth control or medroxyprogesterone acetate, which is Provera. So that could either be from using a depot shot for birth control, or perhaps trying to change cycles. That is often used as well. It does not balance estrogens. It does interfere with the body's own production of progesterone. It can induce insomnia. It can cause hair loss. It can increase acne. You see some bloating with that, again, because of the estrobolome and also the changes in the gut. We do see depression, headache, decrease in libido as well. And we do know that some progestins can actually cause spasm of the coronary arteries. Progestins through the WHI were shown, along with equine estrogens, to increase the risk of breast cancer. And there are several citations right here. So progestins have shown an increase in breast cell replication and growth due to the stimulation of the estrogen receptors by progestins. So instead of binding those estrogen receptors and allowing them to work more efficiently, this actually escalates or stimulates them. And again, there's some citations there. And natural cell apoptosis is inhibited by medroxyprogesterone acetate, which is really unfortunate, because then you just see an elevation in breast cancer cells. And again, going through this is that breast cancer mortality also appears to be an increase with combined estrogen and progestin use. And that, again, is not just any estrogen. Certainly not topical, but it was oral and mainly focused on conjugated equine estrogens, as well as high dose estradiol and synthetic estrogens like ethinyl estradiol. It can increase LDL, decrease HDL. So that's opposite of where we really want to see that cholesterol panel going. It can make overall symptoms worse. It does protect the uterine lining from overproliferation in some situations, but it does counteract any positive effect of estrogen on serotonin. 90% of serotonin is made in your gut. So if your gut's kind of messed up and your estrobolome does not look so hot and the biome isn't great either, you're not going to produce much serotonin, and you're going to be sad. You're just going to be, really bummed, which is not where we want to go. So these are some of the natural progesterone effects that we do not see with progestins. And it's kind of a summary of the previous slides. Studies have shown that progesterone does not induce estrogen-stimulated breast cell proliferation, specifically on these two trials. One was done in 2011, and this one was summarized in 2009. And again, here's even more references for the previous slides. Yes. So prolonged use of progesterone without adequate estrogen. So sometimes women will just start taking progesterone, which is available over the counter in Progest or a natural progesterone cream. You can see an increase in weight gain. You can see bloating. It does increase insulin resistance, increase of fat storage, especially around the belly. And we can see a decrease in our ability to metabolize carbohydrates and it can increase insulin resistance. So again, it's all about balancing. Please test, don't guess. And just kind of continues on with some of the issues with an imbalance of elevated progesterone without adequate estrogen. So moving on to testosterone, we know that the function of testosterone is usually to start menses. We do see an elevation of testosterone right prior to menarche. It increases sexual interest as well as sense of emotional well-being, increases muscle mass and strength. It can help maintain memory. It helps the skin from sagging because of how it works on collagen receptors as well. And it is one of the essential components of maintaining healthy bone, and helps with pain control, which was really interesting because there was a study done with topical testosterone and colchicine topically to lumbar back pain. And that was really something. It was a very small study, but they did have positive results with that. So symptoms of testosterone loss are pretty typical, and it's what we see not just in women, but also in men. So if you actually see where the eyelid kind of droops and it starts to kind of impede the natural top of the eyelid, that's usually low testosterone. And we see that in men a lot, but also in women. Women make about 0.3 milligrams a day in their prime. So we just don't need a lot. These are causes of low testosterone. So menopause, childbirth could definitely do that. Specific types of chemotherapy, adrenal stress and burnout, wide variety of conditions such as endometriosis, as well as psychological trauma, specifically TBIs. You can see a drop in testosterone as well. And birth control pills can definitely change because, again, those synthetic estrogens are going to increase sex hormone binding globulin, which is going to decrease the availability of testosterone in the body. So how do we manage these symptoms? You know, a lot of times, especially with vaginal dryness, it's probably the most common thing that we hear about. It's like, oh, honey, it's just vaginal dryness. It's not that big a deal. It's like, well, yeah, it is. It's a huge deal. I don't want my vaginal vault to become so thin that the bladder falls in or the rectum falls in. That wouldn't be cool. We need to keep everything where it goes. There was a question, who would you recommend to see that follows this philosophy on testing? There are a lot of providers around that test and they don't guess. Most of them are naturopaths, and we actually have quite a few. Well, we've got a referral station. There are also some naturopaths on this call. So we can help facilitate recommending people. But what I will say is that we do not necessarily advocate that you leave your current provider. We work with all providers, and sometimes it's just a matter of education, and we're happy to help with that. And sometimes, you know, there's a wide variety of allopaths that, whether they're nurse practitioners or physicians, they literally will say, go see Michelle, go see Maker's Compounding Pharmacy, go talk to the pharmacist there. They'll get you set up with testing. They'll help guide with dosing to start with, or at least help follow. And then we can help kind of bridge that gap. We never ask people to leave their current providers to go see someone else. However, with that being said, a lot of times we need more than one provider in our arsenal, so to speak, to really take care of us. Not everybody is well equipped to understand the entire endocrine system, along with muscular skeletal system, as well as, cardiac system, So a lot of people specialize, or they focus on certain areas. And so a lot of times we do need a variety of providers. And it's whatever's going to work best for you. So what we usually suggest is have a conversation with your current provider, and come up with a few questions, see what they are going to say, see what their answers are, and then maybe set up appointments with a few other providers to see how they work. Maybe a get acquainted appointment needs to be arranged, and ask some questions about specifically hormones and their philosophy on hormones. There are some naturopaths that focus on geriatrics, older people, and they don't do hormone testing. So just because there's an ND behind their name, again, doesn't mean that they subscribe to this either. So it's really about finding that person that's going to fit best with you. We're not necessarily here to say, oh, you can only go see this person. That isn't how we work. I take very seriously the information that I provide, and I want people to feel as good as absolutely possible. So I think it's, super, super great when we can connect people and that they work together. So we're more facilitators than anything else. So there's a wide variety of treatments. There's a wide variety of commercially available options, most of which we see compounded. And that's because then we can really hone in on very specific individual doses. Because when we deal with commercially available estradiol, so for example, there's one gel, it's super expensive. And then there's patches, and then there's a oral tablet, and then there's synthetics that are oral. There's synthetics that are topical in patches as well. But, when we're dealing with patches, I think there's only like, there's like 5 doses, 6 doses. Well, holy cow, there's more than usually 6 people in a room. So, and then cutting those patches, that's not necessarily the best route either, because medication leaks out. And if you exercise and you have a patch on, you're going to burn up that patch very quickly. And then you will literally have a huge surge in dose, and then you won't have anything for the next few days before you actually replace. So that's why a daily application of hormone cream is usually a better way to go about that. And then we also talk about personal lubricants, especially when we're dealing with vaginal dryness, because some of them can be irritating, and some of them are not necessarily very conducive to decreasing UTI.
Michelle,
You're very
we have
welcome. Yeah.
a couple of questions. I think you're reading them now.
Yes, thank you. Exercise metabolizes the patch faster. It actually pulls it out of, so when you exercise, your skin becomes warm, right? And that heat will literally suck the medication out of the patch. So it doesn't metabolize it. It literally pulls it out of the patch and dumps it in your body. So that's what happens with that. For testosterone, would you recommend women taking it, or do you prefer managing testosterone level by modulating other pathways, including recommended the precursors like DHEA and pregnenolone? That is a fabulous question. And quite honestly, when women use either 7-keto DHEA or low doses of DHEA, a lot of times that is going to help convert to testosterone. I like to start there, quite honestly. Testosterone topical is a controlled substance. Not everybody can prescribe that. Not everybody has a DEA number. So depending on your licensure, naturopaths can, if they have a DEA license, again, very expensive little piece of paper, it's you can prescribe codeine, which is a Schedule 2, and you can prescribe also a Schedule 3 with Tylenol. And you can prescribe testosterone, and that's about it. So you have to be careful with that. Pregnenolone sometimes will be metabolized onto DHEA and testosterone, usually not. It usually stops at progesterone. Both pregnenolone and DHEA are available over the counter. I do caution, especially in women, sometimes 7-keto DHEA is a better product, and start low and go slow. So I would definitely start with like 5 milligrams of DHEA if her levels are pretty low, and then slowly increase. You can always increase it, but if she further metabolizes to testosterone and estrogens and you started too high, like at 25 milligrams, she might be meaner than a snake and really ticked off. We don't want that. Do you recommend cream over oil? Absolutely. And this is why. Oils tend to sit on the skin. They don't necessarily penetrate because the first few layers of the skin are hydrophilic. The deeper layers are more lipophilic. So it really, we have creams that are proven to move hormone through the, into the skin and move them into a topical form. And that is definitely not just for testosterone, but also estradiol, estrone, sorry, nope, scratch that, estradiol, estriol, and progesterone. We can also put pregnenolone in there. We can also put DHEA in there. So if you need information on dosing of that, devices, how that's used, get a hold of me, and I'm happy to put together a little show and tell. It's really kind of fun. Mood swings, again, they're not in your head. And this isn't necessarily a natural part of aging. And quite honestly, it's not only depressing, but it really affects overall quality of life. And that doesn't feel good. We can always use a variety of supplements. I advocate for professional supplements. Of course, everybody's got a budget, so we are very cognizant of that. And L-theanine is one of my favorites because it's a natural amino acid that is very calming. It doesn't interact with antidepressants, and we then can also see a little less anxiety and a little bit better control all the way around. Hot flashes and night sweats, will they go away in time? Well, they're not necessarily a lack of estrogen. They certainly can be, but really we need to take a look at what's happening with thyroid, what's happening with stress. Are there vitamin deficiencies? Is her gut a wreck? Is her diet truly sad? Standard American diet. Is she dehydrated? A lot of women are wandering around dehydrated. And does she need a little protein? And so what I usually do is I recommend, after a conversation, I recommend just trying something different for 7 days. You don't have to try it for a month or 3 months or whatever. Just try something different for 7 days and then journal exactly what you're doing. So are you going to take gluten out of your diet for a week? Okay, well, write down everything that you're eating and drinking, read labels because gluten hides. And then see what happens. Have you increased your hydration? Are you drinking half your body weight in ounces every day? So if you weigh 150 pounds, are you drinking 75 ounces a day? Are you balancing your diet? Are you eating more cruciferous vegetables and less trans fats? What are you doing there? So write it down and document it so that you remember. Because again, when we have hormone imbalance, it's hard to remember. And if you're not sleeping well, there goes your memory as well. And libido is, that's probably after vaginal dryness. We talk about, changes in sleep. Libido is usually the third thing to come up. And I think the reason why it's not necessarily always the first is because people are a little bit shy about wanting to talk about their sex life and their desires. And quite honestly, that's a natural part of being a human. We need certain things to survive, and that intimacy doesn't necessarily have to be sex, but that intimacy, that bonding is something that we all crave and is very much a vital part of who we are. So whether we hug another person, so a woman to woman hug, you're actually going to increase oxytocin levels higher than a man to woman hug. And I think that sometimes it's because there's a thought of a different agenda there. But when moms are brand new and they hold their babies all the time, their libido is low for a reason. Number one, the body needs to repair after that baby has been born, and there's a lot of reconstruction happening and reassimilation of vitamins and nutrients, and perhaps she's not supposed to get pregnant right away. So our oxytocin levels increase just by holding that baby. But because we've got that touch and that bonding with that baby, a lot of times bonding with someone else and touching someone else isn't necessarily high on the list. But oxytocin is fabulous to help not only with libido. We do put it in a nasal spray. That's why we have this picture here. but we can also use it as a non-hormonal way to enhance vaginal vaults. It can be used as a sublingual drop, especially for grief and depression, but we don't use it in a sublingual troche because the troche bases have to be warmed up, and that heat will actually reduce oxytocin activity by sometimes 80%, and that's not the point. So then we move on to weight. It's like, is there something special about this product that is flashing all over Facebook? It seems to be like every 6 slides, I see something for Pro Vitalize, and I see all this other stuff going on the TV. And, is it as easy as this actress who took this product and she lost 40 pounds over a certain amount of time? And is it that easy to just take a pill and lose this? And I don't think so. There's a very huge surge in the use of injectable semaglutide as a peptide to help curb appetite and lose weight. And a lot of people do, but you do have to be mindful of your carbohydrates. And so, perhaps it's a carbohydrate and exercise issue to begin with. We do use naltrexone. We do see that combined with bupropion in Contrave. We compound low-dose naltrexone because not everybody can handle Contrave. Not only is it super expensive, but sometimes people just have really wacko dreams. So if we use lower doses of low-dose naltrexone and we use bupropion separately, a lot of times we can hone in and help her to move through this. But, quite honestly, when we see the bulges around the tummy, that is usually not just changes in carbohydrate intake, but we also see a lot of stress. So cortisol goes up. And how does thyroid play into all of this? Well, if estrogen is high enough, it can actually suppress thyroid function. If cortisol is elevated, again, we see lower thyroid functions, and we don't necessarily see those changes in lab tests. A little bit, but not always. But TSH was never meant to be a gold standard for evaluating thyroid function. So this is a picture that is in Mark Starr's book called Hypothyroidism Type 2. And this is actually a picture of a woman from the early 1900s. So this picture's over 100 years old. And quite honestly, I see this lady every day walk into my pharmacy. She's puffy around the eyes. She's puffy around the cheekbones. You can actually see how she's kind of a little full in front of her ears. Her hair's kind of flat. She's kind of a receding hairline. She tends to be thick under the chin and thick through the neck. And her fingers look like she's got a lot of excess water weight in her fingers, right? So if we test the entire thyroid panel, looking at TSH, free T4, free T3, TPO, which is an antibody, TGB, which is another antibody, and reverse T3, which is the evaluation of what cortisol is doing on the thyroid gland, then we have a better picture, because truly the wide variety of symptoms look like a white puzzle. And so I don't know how you're going to put together a white puzzle unless you start with the corners and then the edges, and then you have a lot of information to work with. And if if we don't have a lot of information to work with, then we're throwing darts at a dartboard, and we don't want to throw her into palpitations and other issues as well. And I will say that right now we are fighting, and I literally mean that, we are fighting to save the ability
Uh-oh, it looks like we have lost Michelle. Are you there, Michelle?
I think my internet went down. Can you hear me?
Yes, I can hear you now.
Okay, so let me see if I can get back into this.
Okay.
Are we back?
Yep. We are
Okay, there we
back.
go.
You also have a question that just came through now
Oh,
that
yeah.
we've had a forced pause. If you have time, could you touch a bit more on reverse T3? What is the
Yes.
role of cortisol on reverse T3? That
Oh,
might be a long
excellent question.
conversation.
Yeah. Okay. So TSH, thyroid stimulating hormone, is released from the pituitary, right? And it comes down, it stimulates the thyroid gland, and the thyroid gland primarily puts out T4, which is inactive, levothyroxine, inactive. Little bit of
We've lost her again. I have texted her. I think she's back.
there must be something, I don't know what's going on, but yeah, my husband's telling me that everything is like going crazy. Okay, so let me get back in here. As I get back in here, I will
We heard until T4 from thyroid gland. That's
okay,
where we
thank you.
left off.
So T4 is then converted to T3, inactive to active, through an enzymatic process of pulling an iodine off. And that is a calcium dependent process. And that happens on the cellular membrane. If cortisol is too high, it converts to T3, but then literally flips it around and it becomes reverse T3. So when you are evaluating what is happening with what's actually happening with these thyroid levels, if you don't test for reverse T3, it's combined with the overall T3. So if you're only looking at total and free, you're not separating out reverse T3. Reverse T3 is not active. So she still has all these low functioning thyroid symptoms, even though her labs probably look fabulous. So the other thing too is that enzyme process of deiodinizing the T4 to T3, so literally plucking an iodine off, that is calcium dependent. And that's why a lot of women who have inadequate thyroid control for decades end up with osteopenia and osteoporosis.
So does that mean that cortisol flips free T3 to reverse T3?
Correct. Yes, and reverse T3 is inactive. Yep. Can you see the slides, Scarlett?
I cannot.
Oh, dang it. What the heck? Okay, let me see. Where is my, I gotta find my, boop, boop, boop. Back to Zoom. Share screen. Ta-da! There we go. We're back.
I can see it. Yep.
Yay. I'm so sorry. This has just been a crazy night. So yes, free T3 will flip to reverse T3 because cortisol will literally rotate it. And it is not active. So it will increase symptoms and yet labs look good. It's very confusing. So this is a little bit about what stress does. It also causes binge eating. That in itself can suppress thyroid function. All of it. Yep. Yeah. All of these good things. All of these bad things, really. But, you know, quite honestly, everybody has stress. Even the one thing that I learned recently from Kiran Krishnan, who is a co-founder of Microbiome Labs. I was at a talk that he gave last week, and he said something that just blew my mind. He says, you know, even intermittent bouts of stress can change what's going on in the microbiome. And it can, over time, even if you have little stressors here and there, can definitely change how we utilize our hormones, but then also what actually is made up in the gut. And sometimes the bad guys take over, and that can be just it can be a myriad of really confusing symptoms further down. I heard, oh, okay, let's see. Okay, I think did I answer all the questions? Yes, I think I did. All right. So really, there's some great things that we can do about stress, because everybody has stress, and literally the last couple of years have just really been crazy for everybody. So anytime that you can take time to, you know, really relax and take some deep breaths, drink some water. If you have the opportunity to go barefoot in the dirt and the grass, that's a wonderful way to ground as well. But just to really take a moment for yourself and help to bring down that cortisol level. Very, very important. Chronic elevated cortisol can be very dangerous, leads to cardiovascular events. It leads to a wide variety of other problems as well. So there's a lot of different kinds of testing that's out there. We did talk a little bit about what's available. I also like to take a look at genetic testing. I don't do that here at Makers. There is a nurse practitioner in Green Bank. Her name is Toni Marthaler. She is a genetics counselor with 3x4 Genetics. 3x4 Genetics is a company, by the way. That is a real quick cheek swab, and it looks at 36 core elements so that you can literally make small elemental changes and evaluate what is going to be best for you. So some of those core elements are, how well do you utilize exercise? What's going on with brain health? What's going on with thyroid health? But even, do you metabolize salt? Do you metabolize caffeine? And what are your inflammatory markers? And what does that look like? I think it runs about $500. It is really helpful to understand how to manipulate your lifestyle so that you can, again, use this information to be the best individual that you want to do and gracefully age. Thyroid testing is only done in blood, whether it's full serum or blood spot. And the blood spot test that's offered through ZRT Labs looks at TSH, free T4, free T3, and a TPO. They can expand that panel and look at the other components as well. I really like to look at vitamin D. I know that insurance doesn't like to pay for it. ZRT is, the price for that is $75. You know, the normal range is 30 to 100, but optimal is 70 or above. And there is a pretty amazing chart that is available that shows that if you kept your blood level of vitamin D, you will probably minimize your risk for a lot of different kinds of cancers, everything from colon to breast to thyroid to even some of the lymphomas and things like that. Oh, thank you, Scarlett, for putting that in there. I appreciate that. And then, of course, when we look at hormones, you can look at them in saliva, and that's actually what's representation of what's happening in the cell. Urine looks at what your body is actually done with those hormones and then excreted out. And then a blood is a way of looking at hormones, which are oily substances in a water matrix. And so it is a very quick snapshot, and it is great for evaluating some of the hormones that don't migrate into the salivary pool, which thyroid does not. It's just a quick look at some of the kits that are available. They're very easy to use. There's amazing directions. It comes with prepaid postage. There's an envelope in there. There's a UPS label, has all of the devices that you need, whether they're collection tubes or little finger prick lancets, and there's cotton swab and band-aids. I mean, it's really a full full kit. The dry urine kit, the only thing the urine kit doesn't come with is like a collection device. So you do need to have a container that you can use to collect, but it does have the papers that you just dip in there and then let dry and then send it off. So, as a consumer, what can you really do? And these are some holistic ways to take a look at small ways to make an impact. We are in the middle of December here, or sorry, October. I'm looking at another calendar right behind my computer. We're right here in the latter part of October, and we've had some beautiful, beautiful days. Lots of sun, but a lot of smoke out there too. But soon we're going to, fall back in our time zone. So we're going to be getting up and it's going to be dark. We're going to come home from work and it's going to be dark. So really finding a little bit of time that you can go out and capture some sun, get some sun on your face, on your arms. If you have the opportunity to lift your shirt and allow your tummy, kind of your liver area, to be exposed to the sunlight, that's going to help build vitamin D stores in your liver. To decrease white fat accumulation. So again, if you're packing on a few extra pounds, I definitely am right now. I'm actually going through some rebalancing issues and some physical issues that I'm working through. So there are some sound wave devices that can help. Yin yoga is very helpful, especially for those who can't sit still. If you're constantly in the move, there's some ways to look on YouTube, look up yin yoga and take a look at that. And anytime that you can ground yourself, literally put your feet in the soil, that is a way to move energy and literally reposition some of the elements in your body to help decrease stress. Now, this is a gut test that I found a couple of years ago. I found this actually through Dr. Pam Smith, and it is through Microbiome Labs. And Chad Grant is the local rep, and he has these fantastic tests that are available. It is a stool test, but it is a complete DNA sequencing of everything that's going on in your gut that will definitely affect what is happening with your brain, what is happening with muscle, what are you doing with your hormones, what are you doing with your vitamins? And all of this leads to digestion, your skin, your mood, as well as how to change the outlook for your future so that you can be the healthiest individual possible. I had a really nice man who I've known for a number of years. He's a diabetic. He is insulin dependent. And he was having a heck of a time keeping his A1C down below 7. And anything over 5.5 is just not the greatest. And he eats a really decent diet. And he literally looked at me, he says, I don't know what else I can do. He takes his oral antiglycemics and he tolerates those pretty well. And he just didn't know what else to do. He exercises, he drinks plenty of water. And what we found is that when he did this Biome FX gut test, we found that he had some pretty nasty bugs in his gut. And we were able to do the 3-month gut restoration, and he was able to bring his A1Cs down. Last time I talked to him, they were 6 and headed lower. And what he also found is that he felt brighter. He actually could find his words better. He didn't have certain cravings. And, he just had better digestion. He was feeling really good. His wife was going to do this as well because she is not feeling so great. But the bottom line is you don't have to have a significant gastrointestinal upset. You don't have to be diagnosed with irritable bowel syndrome or small intestinal bacterial overgrowth, Crohn's disease, any autoimmune or anything like that. You can do this test and it will give you great information. The test is, there's physicians available at Microbiome that can help evaluate, pardon me, and help you understand the contents of this 20-page report, it's huge. It is so much information, but it's great knowledge so that you can feel better and really get to the root and some of the core elements and make a difference. This again goes through some of the specifics. We have seen where when we don't have the right mix of good bacterium in our digestive system, which actually starts here at the mouth, that a lot of times whatever is growing in our mouth actually slips into our small intestine and even into our lower intestine. And that can have a higher risk of cardiac issues as well as cancer risks. So I think it's really important to understand where those are, and then your provider can help work through whether you need over-the-counter professional supplements to change the biome. Maybe there's some really good probiotics to help change that. Maybe there's some IgG that's needed, or other specific supplements to help reduce, like H. pylori. I mean, there are supplements that can help with that. And we know that even when you have peptic ulcers or a wide variety of gastrointestinal issues, usually you're higher, you're much more prone to higher blood pressure, higher cholesterol levels, even dermatology issues. Your skin just doesn't feel as great. And we do know that a wide variety of autoimmune issues have a gut component. So when we understand what's there, we can maintain the good, decrease and possibly eliminate the bad and the ugly, and put things back to where they need to be. This is a picture of the total gut restoration process. They actually have new labels since this picture was put together, but it's a 3-month process. And this kit is complete with 3 months of the probiotic, 2 months of the prebiotic, and 1 month of the restorative or the rebuilding of the mucosa. And so this runs about $330 for the 3-month supply. It's really easy to use. I will say, whether you use the prebiotic and the mega mucosa in a capsule or a powder, there are some dairy-free options as well. You need to drink a lot of water. Otherwise, you'll be in the bathroom. It does stimulate things to kind of get going. Hyalife is another product that I really like. It is a hyaluronic acid, and we know that that's a building block for a lot of cells and collagen to rebuild. So it's easy to moisturize the body from the inside out by taking 3 capsules a day. It really helps with dry eyes. I notice that when I don't take it, my eyes are definitely a lot drier. But we also see less complaints of joint and like low back pain. And it's not terribly expensive. It's and it's easy to take. They're very easy to swallow. When we talk about commercial products versus compounded therapies, I wanted to show some action pictures. So the top one here, these little squares are troches, and they're scored so that they can be broken up. So you'll see a whole troche, a half, and then 2 little quarters. And we can put a variety of hormone in there. There is a maximum amount of hormone that we can use. We tend to use estrogens and progesterone, and sometimes even testosterone, DHEA, pregnenolone in a sublingual troche. It is harder to capture a salivary pool evaluation if someone's using a sublingual product. And we also use sublingual drops for that. So each one of these hormones I did kind of roll out into the different dosage forms that we typically use. Do you need a prescription for Hyalife? No, you do not. It is available over the counter. You can call the store and they can get some for you, and they can mail it to you even. It's very easy to have. Oxytocin is a nasal spray primarily. We can put that in a vaginal cream if someone is looking for a non-hormonal product for vaginal atrophy. This is a little tiny pearl that we use for vaginal atrophy as well. We can throw a little estradiol or a little estriol. We even put a little bit of DHEA, perhaps even testosterone in that. These are pearls. We also have vaginal suppositories that are about 1.25 inches in length, but they're only about not even 1/4 inch across. So they're just a very small suppository. So when they melt, you're going to get a really nice coating of the vaginal vault, but yet you don't feel like you're soaking wet, that you get up the next day and you feel uber goober all over everywhere. Allage is a fabulous vaginal base. It's absolutely my favorite because it has mucoadherent properties. So again, we can put the estrogens in there, even progesterone, testosterone, DHEA. And so when you use that Allage cream and you put enough into the applicator, you put your dose in the applicator and then put the applicator high into the vaginal vault to release the cream, it sticks and it stays there. So you don't feel wet and gooey the next day. Other questions? Oh, thank you, Scarlett, for adding that detail. Yes, you can always text us at our phone number as well. That makes it really easy to order products and even send in a refill. We can definitely do that. I get a lot of questions about herbals. What supplements can I take over the counter that can help with hormone replacement? They don't replace hormones. They will enhance what is already going on in your body, but they won't necessarily replace hormone directly. Not everybody can pull hormone out of supplements, whether it's an even primrose oil, a black cohosh, or even chasteberry. You can get active hormone in DHEA over the counter, and you can get other libido enhancers over the counter as well. DIM and IC3, which is indole 3-carbinol, are they're herbal supplements that we use to help metabolite excess hormone out of the body. I also wanted to just briefly touch on low-dose naltrexone, because when we're dealing with women who are infertile or who have autoimmune disease due to hormonal issues, we tend to use low-dose naltrexone because it does help to reduce pro-inflammatory cytokines in the body. It helps to support natural hormone function, normalizes thyroid function, and it is a very, very well-studied molecule. There's, at this point in time, here we are in October of 22, there's almost 950 scientific studies and case studies that are available. My favorite is the Dartmouth study, which is the compilation of the first 900 that was produced in 2018 or 2017. And it summarizes the first 900 articles by disease state, which is really helpful. Like I said earlier, you do not have to change doctors. Testing is something you can actually order on your own. It will not be covered by insurance, so that is an out-of-pocket expense. So please be mindful of your budget. I will say, if you do testing and you have not talked to your provider, that can be kind of a slippery slope. It's better to be transparent with your providers and let them know what's going on ahead of time before you dive into testing. I don't want you to waste money on something I don't prescribe. I'm a facilitator, an educator, and a compounding pharmacist. I can make your medications, but I need a prescription to be able to do that for you. There's other things you can do, like I talked about earlier, is you can change your diet for even just short periods of time and understand what those foods that you've eliminated, how they've changed, what symptoms you may be wanting to correct. And then, quite honestly, don't settle for anything less than good treatment. There's a lot of different options out there. The FDA is definitely trying to, they're overstepping. They're trying to take away your rights and your access to compounded hormones, as well as compounded thyroid right now. So what can you do about that? You can go out to compounding.com and you can get a hold of your congressperson, your senators, and let them know that this needs to stop. So we are in election year. There is a senator who's up for re-election who has a senior staff person who is in the FDA oversight committee. So it will be interesting to see what happens with the outcome of this election. If she is replaced in office, we potentially will lose ground with our conversations with the FDA. but I am a board member with the Alliance for Pharmacy Compounding, and this is very close to my heart, is maintaining your access to compounded medications. It is very, very, very important. Scarlett put a link to that in the chat. There is on compounding.com, there is some information on how to maintain thyroid as well. And this is where we're at now. Compounded bioidentical hormones continue to be requested to be restricted and be deemed demonstratively difficult to compound, which is a quite frankly is a crock of crap. They are not difficult to compound, and I don't believe that if we were to have to rely on commercially available product, that people will feel better. There was another article published this last April that showed how well compounded hormone therapy is received by the public, and how many women, even men, are doing so well on compounded hormones. And quite honestly, when you're doing really well on a medication, you don't necessarily report that you're doing really well. The reporting system is only set up for adverse events. So that's really unfortunate, right? So if you would like to come see us for Halloween, Thanksgiving, and ornaments, come on by. We are more than happy to help you with anything that we possibly can. We do compound veterinary medications as well. And we have a very nice line of vitamins and supplements. And if we don't have it on our shelf, we're more than happy to order it for you. We can even have it delivered directly to your door. And this is how you can get a hold of us, either through makerscompounding.com or the LDN Pharmacist. These are our social media handles. You're more than welcome to friend us on Facebook, on LinkedIn, on Instagram. Yeah, we'd love to be your friend. We also have a wide variety of seminars up on our YouTube channel. So subscribe to our YouTube channel, become a frequent watcher, and we're more than happy to share additional information. This will also be up on YouTube very, very shortly. And in November, on the 16th, which will be a Wednesday, we are going to talk about LDN and the root of autoimmune issues. So please tune in for that. And I just found out today that on November 17th, for those that are part of the Seattle Integrative Functional Medicine Group, I will be speaking for them on LDN as well. So we hope to see you on the 17th. And very shortly, we will have a schedule of our 2023 seminars. And anytime you want to register, please send in a text to our phone number and text in webinar, and you'll get a link directly to that. And certainly if there's any other questions that I may not have been able to get to, please put those in the chat and we will get to those. But otherwise, I want to thank everybody for joining us this evening, and we hope you have a good evening. Thank you so much. Have a good night.